Happy Friday, PSWs and friends across Ontario and Canada. Welcome to PSW Podcast, where we come to you guys live every single Friday at 11 a.m. or today, 11:01 a.m., and where we talk about everything healthcare, PSWs, the good, the bad, the ugly, and we don't leave anything up to the imagination. And today I am joined by my co-host, obviously, Ian DaSilva, who's the Chief Operating Officer of the Ontario PSW Association and the Canadian Support Workers Association. And because I forgot to introduce myself, I am Miranda Romanowicz. I'm the CEO of both associations myself. And we are here to talk about something quite interesting today, Ian. So take it away.
Yeah, I think we're on part 517 of our series on title protection in Ontario over the last 10 years. So we're here to talk again. We're here to continue on with the discussion of title protection. We've gotten some comments anecdotally from members asking, basically realizing at this point that title protection is becoming a necessary requirement for personal support workers in order to maintain the integrity of the system. Recently I was shared on LinkedIn an article with regards to an issue that's happening in the United States. Now, the United States has a very different health system, as we all know, than we do. It's extremely decentralized. And the issue that they're running into in the States is physicians, doctors, are becoming concerned. And the Hastings Center for Bioethics on June 15th, 2026, just about a month ago, issued an article, and the title is Physician or Provider, What is in a Name? The summation of the article basically goes on to argue that the concern that doctors are finding in the States is that their health care HMOs are basically, those are health management organizations which coordinate insurable products to those clients. They're starting to no longer refer to doctors, physicians, as doctors. They're calling them providers, health providers. Now, the concern, of course, is that this erodes, the doctor's concern is, of course, this erodes the integrity of their education, this erodes the integrity of their training, this erodes the integrity of what they do, and it further commercializes the nature of their care. So it reduces their entire training down to a transaction, which is kind of the opposite of what the intent of our physician ethical community is based on, including PSW. So it's funny that we're facing the same challenge with our with our PSWs, yet in the States they're finding the same issue with medical doctors. So you're having this issue where the doctors themselves are now seeing their titles threatened. So what is in a name? It was in that shape. It's in Romeo and Juliet. A name by any other name? Not necessarily.
No. And that is really interesting because, yeah, we always kind of seem to kind of loop back to that whole title protection, which is really important for PSWs to have. And it definitely is a possibility, a very high possibility now that we have the HESCPOA in place, that PSWs will get that title protection, because otherwise, how will the CEO of HESCPOA do his job if there is no set scope of practice and title protection for the individuals that are performing the job? But when you look at healthcare, like you have, I couldn't imagine like a doctor. These are PhD. These are doctors. And for someone to say, no, now you're a provider. Well, if they're doing that to doctors, who's next? I mean, they're still doing it with PSWs, where like you have a PSW, but they're called like a porter, or they're called like a special assistant to something, or a supportive care aide, or we have HSWs, and we have all these different titles that we say fall under the PSW. But unfortunately, PSWs are being called these things in a lot of workplaces. Now, one of the interesting things I found, I met with some PSWs yesterday, and we talked about the $3 wage enhancement. And so this is going to be a big thing that comes up, is which is still happening. It was, it became fixed in from the government, a $3 wage enhancement for all PSWs working in the public sector. And one of the PSWs was like, but I'm called clerk / PSW. So because of that, they're withholding my $3 wage enhancement. I said, well, that's not right. She goes, but the money comes from the government, right? I said, yes, it's from the government. It's a $3 wage enhancement. And she goes, oh, well, the home's telling me that the $3 comes from them. I said, absolutely not. That $3 comes from the Ontario government for the personal support worker. So, and then you have the PSWs in the hospitals. Remember, we came into that front where the PSWs were called like patient care aides or some crap like that. And they were not eligible for the $3 wage enhancement. So my question is, the money is being flowed through these publicly funded, long-term care homes, hospital, home care. So where's the money going then? That's my question, right?
It's not going to the patients. It's not
No,
going to the PSWs. It's going back to the companies and the providers. It's being embedded into their general revenue and redistributed. It's
exactly.
exact. And why? Because we have no leadership in long-term care. None.
Well, we don't.
It's a
I mean, right
rudderless ship
now,
right now.
It is a rudderless ship, and there's so much confusion about so much in the PSW world right now, and I really am going to put that onus on the government.
Oh,
Like,
absolutely.
step up, be firm, and tell everyone what the heck's happening. Because the PSWs are all floundering willy nilly. There's so many rumors out there. PSWs do not have title protection, so right now anybody can call themselves a PSW. But that's also not fair to us personal support workers who paid thousands of dollars to go to school in order to get our certificates so that we could work as personal support workers. So something has to become cemented and some movement needs to happen. It's disgusting.
Well, it's when you have no integrity in the leadership model at that ministry. What are you supposed to? What are we dealing? How can we work with that? There's no leadership. There's no direction. There's no policy incentive. There's no there's no even concept of what they're trying. The goal is. So I'm at a loss, and
Yeah.
yeah, I don't know what else to say. But this is
But I mean,
exactly the issue we're dealing with. So you can see that the current incentive within the ministry of long-term care is to continue rapidly privatization of the care delivery models. Because look at you just highlighted it there. We have no the minister is actively ignoring this corruption. That $3 is now being siphoned off. They're still getting the PSW numbers. The minister still says that the numbers are great. The company's making money. The PSW doesn't get anything.
yeah,
What kind of system is this? This is an aggressive privatization.
it is.
It needs to be
It is.
investigated, like seriously investigated.
It needs to be investigated because and the majority of the homes that we're speaking about are the for profits, the for
Exactly. Yes.
profit long-term
These are
care homes.
for-profit
We
long-term care
find
homes.
that the non-for-profit and the municipal homes seem to be doing a lot better, and they kind of fall in line a lot better than the long-term care homes. But we know that with the for-profit long-term care homes, it's all about profit.
Well, yeah, that's what they're there for. They're there to make
Yeah,
money. You're kidding yourself if you believe that a for-profit home is really there to
help.
do anything other than protected shareholders. If you believe that,
It,
then
I will tell you though, yesterday, Ian, like when I was standing with these wonderful personal support workers, there was even
yeah.
two HCAs, like the original, the OGs of the PSW world, our healthcare aides were standing there and they're worried. There's fear, there's uncertainty, there's so much happening in the field for them. And a lot of these long-term care, like when it comes to Escapoa, they're using this method in order to, create that fear, create that divide. And like I said to the PSWs yesterday, is no, you can't allow that to happen. That's why we exist, because OPSWA is here so that you can get the actual information. We talk to Escapoa all the time.
Well, we do. And here's the other side of it. The ministry's been bragging about how they've had all these PSWs, they've reached these numbers. If this continues down the road, they're going to have to withdraw that statement
Not only that, though, can I
because
mention something else
it's
that
going to
got told to
reverse
me
it.
yesterday? I'm going to tell you something else that got told to me yesterday. And I do love being face to face with my PSWs, and these PSWs were phenomenal. Hard workers, have been in it for a long time, looking at 15, 20 years. These were the OGs, right?
Yeah.
But I'm just saying that, when I asked them, this is a very small long term care home, okay? It's not a big one. I asked what their ratios were. How many residents to a PSW? And I was expecting, and maybe my naivety, my hope, my dream, I was hoping that it would be, a decent, because there were so many PSWs there from what I could see. The ratio was one PSW to 10 to 12 residents. Why? Why? Like there was no reason for that. Absolutely no reason for that.
That's a
And
lot.
it, and that just and I'm just like going back to what we've circled around time and time again, and I'm sure everyone who's watching can definitely feel our frustration and our anger about this because there has been no movement. Like I said to you the other night, Ian, over 16 years, the association has moved mountains that people said were unmovable.
Mhm.
But there's certain things we just can't get a grasp of. They
No,
just keep, I don't know, for lack of a better term, they keep lubing it up. We can't grab it because they don't want to, they don't want us to enact that change because it's making money for the greedy.
once you have title protection, and you nailed it on the head there. Once you have title protection, then that ability to switch titles in order to recapture those revenues accordingly will end. At least it should end because there'd be no titles. There'd be no such thing as a clerk PSW or yeah, exactly. I'm going to take the money from the government, that $3 an hour, $27 an hour, and I'm going to pay the PSW 19, but I'm going to call them a PSW clerk and make
Gross,
and
gross.
I'm still achieving my numbers and everyone's happy.
Here again, and,
But
and,
what
and
was
you're
but
big
we
on.
had those same issues though. I mean, when you're dealing with 1 to 12, you're talking about incontinence changes. Now I was at a home earlier this week, and it's great. Like this was a private care that had in a good area, really good model, excellent number of PSWs, great ratios. So not all providers, but
Oh God, no.
uh, so this was what was it, Sienna I was at?
You were at Sienna. You were
Yeah,
at
they were great.
yeah, they were fantastic.
So
Yeah.
before I badmouth yeah, well done, Sienna, you have a great model there. But there are other ones. We're seeing this from other companies. I've lost my train of thought. Sorry,
Well,
sorry.
you've seen it where we go into
We see.
certain
Oh yeah,
homes.
they're overnight without incontinence changes. There was an issue we just saw about that. Forgive me, I can't remember
There
exactly.
was a PSW on TikTok who blew up our
Oh, that's
TikTok
right. That's right.
because
Right.
she got let go
Right.
from a long-term care home
Yeah.
because she stood up for herself
That's right. Right.
and her residents. That is unacceptable on so many different levels. If you, as a quote unquote leader, and I use that term very, very lightly,
In
in
this case,
long-term
possibly.
care cannot handle your employees coming to you with valid complaints and you get rid of them because there's a valid complaint instead of fixing that issue, then you need to be removed out of that leadership position immediately
Well, you need
because
to have a yeah.
it's
Yes.
disgusting.
Well, what
You,
is
you, you need to take that stuff seriously. Who knows the residents best? The personal support worker.
this is this and just to jump in here, this is where the OPSWA does help our members. You're dealing with a situation like this, we would file a grievance with the Ministry of Labor. These are things, especially if you have a union that's backing you. We have some great unions that do amazing work, but sometimes you get a steward that's very close with management. I've said this 1,000 times, and your issue is going to be sidelined. This is where the association comes in to hopefully bring the parties together and or at least file some sort of remedy through official channels.
Exactly. And we do that for, and I'm going to speak to that now, is we've never had so many members having so many issues. Ian, you are run off your feet dealing with member issues when it, and primarily, if I'm not mistaken, in long-term care.
Yeah, it's exclusively in long-term care. Again, there's no real attention being paid to long-term care right now, like from anyone, let alone, I mean, I know the minister doesn't, but because she doesn't. I mean, look what's going on right now. Like, let's call
Yeah.
a spade, okay? You can hold as many spades as you want to open up a facility, but at the end of the day, the situation's rough. You're responsible. Fix the thing. Do better. And this is what we're seeing. We're seeing PSWs that are raising concerns, health and safety concerns for the best interests of their patients, and there is that culture of fear, which is being reinforced from the top down to make that PSW be quiet and go away, and then we're going to get someone new in there. It's ridiculous. It's
I
ridiculous.
don't have words. I
I don't
don't
have
have
words.
words.
We will have to build a better conduit to Ministry of Labor and to various other departments in order to streamline some of these complaints going forward, and to
Yeah,
create.
I mean, I was telling one of our colleagues that we've never had this many complaints in
No,
16 years at the association. And when people turn to me and they're like, "Oh, the healthcare system's so much better than what it was before COVID," I'm like, actually, it's gone really downhill. I mean, we thought we had problems before COVID. No, the problems are now. Like I couldn't imagine like. I walked through this long-term care home yesterday. It is a very nice long-term care home. It's very sweet, very quaint. You can tell that they do take really good care of the residents in that home
you
because
tell.
as we all know, at the end of the day, it's about the residents and that is their home and the PSWs do great. But you said to me, right away when you walk into a facility, if it's a good workplace for the PSWs. And it's because of how they respond and how they look. And these PSWs look run off their feet, exhausted and pissed off. That's how they looked. And let me tell you, there was more than a few. I thought one of the chicks was going to throw a punch at me initially. I'm not even kidding because she was so mad about the situation, which I can understand. We have nothing to do with that situation, but she's mad about it. And I feel them. I really, really do. But then I said too, if you want to enact change and if you want to have that backing, then you need to have that double sword, which is union and your professional association, so that we can both go and fight for you. If you're not a member, like I said to them yesterday, I can offer supports to a point. There's only so much we can do legally for non-members because you're not a member. If you're a member, we will hop over mountains for you and fight like hell. But if you're not a member, I can only offer you some solutions.
Yeah.
Unfortunately. And it's not us being jerks saying, go get a membership, go get a membership. It's us speaking the truth. That is legally, we are binded legally by our bylaws when it comes to that stuff. So it was, but I will say at the end of it, they were very happy. They had PSW keychains, they had some PSW
You
swag,
got to raise it's good.
and they were so happy at the end of it all. And I got a wonderful gift from one of the PSWs that actually wanted us to be, that asked me to come. Very sweet PSW. So thank you, Melissa. I appreciate you. But it's going back to the whole concept of we need to regroup. We need to regroup. We need to come together. We need to stop siloing the personal support workers. And I mean, like you said, we've seen it on our page as of late, where they're like, stop doing this and focus on title protection. Girlfriends, that's all we've been doing is focus on title protection behind the scenes and in front of you guys. It takes time, but we have the right allies in place right now in order to hopefully make it happen. We really
Well, well, the integrity, we need to restore integrity, at least establish integrity at this level with the system. Again,
but can I just say to the PSWs that are watching, if you guys are working in different homes and they want to call you a different name, fight like hell in order to be called a personal support worker. You are a PSW. You're not a resident support aide. You are not a supportive care provider. You are not, you know what I mean? You're not a porter. You are a personal support worker, and you all worked really damn hard to get that certificate. So do not allow somebody randomly to call you something else, because that's just not right.
yeah, amen.
That's just not right. So I think we're gonna.
Doctors in the States don't want to be called care providers either.
Well, no,
It doesn't.
we
It
all
has no title.
this.
Yes, I know. You go to school to pay for this, and you're being told, no, we're going to change your title to suit the immediate needs of today, and then we're going to change it tomorrow. Yeah, it makes no sense.
It just drives me batty cakes. But
Likewise,
I think we've made our point.
two things though. I mean, for PSWs, you're getting if you're in a situation, this is why you need to join the OPSWA. You need to have professional liability insurance.
Yeah.
We do advocate for you. Also look at some of the benefits for those if you suddenly find yourself unemployed because you report something. This is what we have some additional coverage for through our members only section. It happens. We've just spoken about it. You do need to protect yourselves. The world can be fun.
The world is changing.
It's changing, and well, it's always changing. But
I know
that as we professionalize you, it is becoming more important for PSWs to take to make sure you protect yourselves.
Absolutely.
What else is going to do it for you?
Exactly. No one else. So anyways, to further on what Ian just said, if you want to become a member of the association, remember it's all tax deductible. We also offer for the PSW membership a 2-payment option or a 4-payment option in order to make it affordable for all PSWs in the province of Ontario. Head over to our main profile, either here on Facebook or on TikTok. Click the link in our bio, and the first thing you're going to see is become a member. You click there. It's all self-explanatory. If you're not a member of OPSWA, you are not protected. That is just the truth of it all. There's a lot of conversation happening, a lot of anger, but through all that anger, I just want to point out to everyone that what you do as a personal support worker matters. And I know I say it a lot, but what you do matters. If there aren't personal support workers, if suddenly we were all gone, the entire healthcare system would topple. And so what you do does matter. We do hold some power in our positions in healthcare. Remember that. Be proud of what you do, and just have faith in the association that we're going to continue to fight behind the scenes and, of course, in front of everybody as well. But I just want to wish everybody an absolutely fantastic weekend. It is a gorgeous day, working or not. Thank you for everything that you guys do. We'll be back again next Friday. Yes, go ahead, Ian.
Yes, I just want to also shout out to a thank you to all employers who actually hire PSWs with the title, with the job description. We slam on those who don't, but those who do, thank you. I just want to make sure we said that because
and there are some wonderful employers out there. Yeah, absolutely phenomenal.
Highlights in the future.
We will. We absolutely will. But thanks so much, everyone, for joining us again for another PSW podcast. We'll be back again next Friday. I believe I am talking with Heather, our educator, next Friday about our professional development center. But anyways, I hope you guys have a wonderful weekend. Remember, if you're not a member yet, hop over to our main profile here on Facebook or on TikTok. Click the link, and it's all self-explanatory from there. I guess that's it, Ian. Thanks for joining me yet again.
Always pleasure.
And with that, I want to say, OPSWA out.